on both
wanted
ones?
to make sure that this was going to be fully accessible
Is it rolling?
for all of our hybrid and virtual folks. So thank you for hanging out with us. Thank you so much for coming to the Food for All panel and discussion today. My name is Jackie Mendelson. I am a policy advocate with Nourish, California. I have the privilege and the honor of co-leading the Food for All campaign and coalition alongside my counterpart, Ben, and the California Immigrant Policy Center, who were not able to be here today, but I have to give them a shout out. And I'm really honored to get to be on this panel to share more about Food for All and have these wonderful guests and colleagues here to share more about their experiences and what they know about Food for All and the Food for All campaign. So thank you so much for being here. I am going to hand it off to our panelists to please introduce yourself, share what your role is, what your organization does, and if you want to share a little bit, particularly for our coalition members who are here today, a little bit about what you in your role do within the Food for All campaign. But I'm going to start by handing it off to Jared.
Hi everybody, is this on? Yes, okay. I'm Jared. I'm with Nourish, California. I'm the director of policy. So I set our state legislative agenda, and my policy area where I spend a lot of my time is CalFresh. So I used to organize the CalFresh Forum until I got burnt out. And so I lead for the Food for All campaign. I co-lead with our co-sponsors at CIPC our capital strategy. So thinking through how we can influence the decision makers in the Capitol, including the governor, to fund Food for All and to implement it. So, thanks for coming.
Hi. Is this on? Okay, everyone's gonna ask. Hi, so Melissa Arvizu. I am the director of nutrition and food security programs with National Health Foundation. So I oversee a couple of programs, which includes our CalFresh Healthy Living, our CalFresh Connection, and then a mini grant that we have with Nourish, California for Food for All. So that's how we participate in the Food for All program and advocacy work.
Hi everyone, thanks for being here. My name is Kristen Acosta, she, her, ella, and I'm the community engagement coordinator with the Women's Building in San Francisco. And in my role, I hold a couple of things. So I hold a lot of the community engagement, the outreach, and the advocacy for our organization. So that means collaborating with our community members, with our partner organizations, and my colleagues at the Women's Building, and developing workshops, community events, sharing resources, and also coalition building. So food justice is part of one of our main focuses, as well as immigrant rights and gender justice. So Food for All is really a part of all of those different focuses, and it really intersects really well. And we this year are part of the mini grant, and it's been really awesome being able to work with the community and allowing them to share their stories and advocate for themselves on behalf of
Thank you all so much. We're going to talk about all of those things, so much more. But first, I do want to hand it over to Jared to please just, what is Food for All? Like, what is the Food for All campaign?
Sure. Can I just get a show of hands? Who thinks they could answer this question? Anybody does no? Food for All is very simple. Let's stop discriminating against people because of their immigration status when it comes to basic food assistance. That's it. We have done that for health coverage in California. First state to do that. Health and nutrition go together. They support each other. There is a wide body of research that shows that good nutrition, in particular access to SNAP CalFresh, reduces healthcare costs, particularly for older adults. I can get more into that, but that's what Food for All is.
Can you talk a little bit about where Food for All has been and where we are right now?
Sure. So Food for All started way back in 1998 or so, when there was a change at the federal level that made some immigrants who were formerly eligible for federal food assistance ineligible as part of welfare reform. those individuals are legal permanent residents, so green card holders with fewer than 5 years residence. I've seen some nods around there. We got some walks here, great. And so I think Washington State was first. California was very shortly thereafter said, well, if the feds aren't going to do the right thing, can we just pay for the benefits as a state and keep those people enrolled in state-funded version of SNAP and CalFresh? And the feds agreed to that. And so that it was the beginning of the California Food Assistance Program, which is a state-funded version of CalFresh. It's exactly the same from a client perspective. The only difference is where the money comes from on the back end. And so that program has been running since then and serves now about 40,000 households. And then, when people have fulfilled that 5-year requirement, then they can transition onto federal CalFresh if they are still eligible income-wise and otherwise. So we've long recognized in our conversations up and down the state with impacted individuals and people like you who do fantastic work to help Californians meet their basic needs, that there is this huge group of people that are being left out. And so there were some attempts toward that. We and CIBC started to get really serious about it around 2018, 2019. Started having some conversations with the Department of Social Services, CATS team, and we're kind of told, who runs the federal administration right now in 2018? Maybe we don't want to do that right now. So we had to wait. But in 2020, we really launched it in earnest, and were able to get a really big win that first year, a commitment to start the planning, the computer upgrades, automation, it's my least favorite word in my work, and things like that. So, I think it was like $30 million or so to start it and get that commitment. And then the following year, we were able to get a commitment that once that planning was completed and the automation was completed, that it would expand in phases. And the first phase would be older adults, age 55 and over. That was a decision that the department, that the administration came to, because they felt, or not felt, it's true, older adults have fewer types of resources that they can access. WIC is something that young mothers and young children can access regardless of immigration status. School meals, that there's no kind of equivalent for older adults. So we were really pleased with that, but it is food for all. So we are not going to stop until it is fully implemented, with no exceptions and no exclusions, and most relevant as we sit here today, no delays.
Can you just say like 1 or 2 sentences about where we're at right now? Like a little bit about what Pat Yang was talking about earlier with the delay with the neighbor vision.
So as Pat said, the budget picture is as bleak, I think, as it's ever been this year. We are subject to wild fluctuations in revenue in California because our revenue is almost exclusively funded by income taxes and capital gains taxes, and those are subject to wild fluctuations of the stock market and things like that. And so we're in a down year. And so the governor's proposed budget proposes a lot of cuts in the human services space. And what they considered as sort of low-hanging fruit were things like Food4All, also the CalFresh minimum benefit pilot, where there were commitments, but benefits had not begun to go out the door. So it wasn't seen as a cut, it's seen as a delay. We're talking about older adults. Not to be grim, but that's not the group you want to tell to wait. And we're talking about people who have waited literally forever to get access to basic food assistance in California. And many of them are people who work in our food system and help us all enjoy the bounty of California and can't afford food themselves. It's a pretty stark irony. And so, what we call CFAP expansion, that's the acronym for California Food Assistance Program Expansion, Food4All, was proposed to be paused for 2 years. And you probably heard me heckling. We're not accepting that. If you get one thing out of this session, it's please call the governor, send an email. For real, this is the time. So we're in the part of the budget right now where the legislature has the governor's revised plan. The governor has just shared last week, this is what I want to do. So the legislature is holding hearings to decide, where they want to negotiate, where they can agree and where they want to push back. And that's all going to happen over the next just few weeks. They have to pass the legislature a budget bill by June 15th or they don't get paid. They're going to pass it by June 15th. And then the governor has 12 days to sign that bill. And so we really are in a sprint right now to reach out to what we sometimes call the big five. The five state leaders who will have the most impact on those decisions. Do you want me to go into that now, or am I getting?
No, we actually will have a call to action for all of you at the end.
I just can't help myself, sorry.
Yeah, no, thank you very much. I do, thank you. Well, I feel like we could talk about all of these things for so long, but I do want to highlight that, Jared just gave a big overview of a lot of our policy, our legislative strategy, what we know, but a big part of Food4All is partnership and coalition. And so while Nourish California and the California Immigrant Policy Center co-sponsor the campaign, we really look to our Food4All coalition, which is made up of more than 120 organizations across the state, to provide expertise and feedback on strategy, on decisions, and to really engage the people who are most impacted by Food4All, and to ensure that that perspective is centered within our campaign. And so that's why I'm so excited to have Melissa and Kristen here, who are both from organizations who are incredible partners of Food4All and are, like you both mentioned, mini grant partners. And so I just wanted to ask both of you if you could share just a little bit more about what it has been like to be a part of the coalition. What are things that you've learned? What does working within the coalition look like for you, and how have you been engaged in that work?
Thanks, Jackie. So with National Health Foundation, it was really easy for us to get involved with the Food4All Coalition, just because part of our vision is to serve any person wherever they're at so that they're able to achieve the highest level of health, right? So Food4All is kind of a no-brainer because the communities that we work with we already know they're in need of these types of benefits. We sign people up for CalFresh directly. We work all across LA County. And I have, several quotas that are out signing people up. And I've talked to you personally, there are people that we have to turn away. There's people that don't get these benefits. We're listening to these very sad stories of people not able to access food, fruits, vegetables, healthy options to feed their family. And it's not like a once a month thing, it's an everyday thing where our community is telling us that they need help, where they're sharing their stories. They're coming in and our CalFresh enrollers have to sit there and listen and apologize for not being able to provide them services. And same thing with our college students. As a mini grant partner, we're able to use that to have a college coalition. So we have Cal State LA students, and they're sharing their stories because while we are doing this for older adults, we're missing so many other families that need these services. We're missing individuals, and the college students, they are sharing their stories about how their friends on campus can't get access to food, right? They're going to the local food bank, and that's not enough because they are paying, or financially burdened that because of financially they're not able to enroll for CalFresh benefits. So there's so many barriers, and for people that already can apply for CalFresh, and for those that cannot, those students are suffering even more. So we're able to work with our community, get those stories, and being a part of Food4All allows us to find a way to share those stories because we're trying to give people a holistic approach to health. But when they can't access their basic needs, there's not much else we can do but apologize. And I don't like that. I don't like having to apologize to someone that I can't help them get fruits and vegetables for their kids or a meal before they're taking final exams. That's never fun. So.
with our community members. We've had a food pantry for the past 10 years, and we're one in six immigrant food pantries in San Francisco. And what that means is that we don't have restrictions, and many folks who come to our food pantry are immigrants, and many are undocumented. So this is really their only way to get food and access to food. So being part of the Food4All coalition was a no-brainer for us. It really intersects in all of our main goals in ensuring that folks have the resources that they need to be able to have that power in their lives. But if there's exclusions to these important and essential services, there's only so much that can be done. So really, like I said, Food4All was a no-brainer for us as an organization, and we're really happy to be able to be that connection for folks to be able to share their lived experiences, to make those systems changes, and to fight for the rights that everybody should have, because everybody should have food. There should be no question about it.
And I mean, based on your leadership and what you are hearing from community members, and also your own perspective and experiences in this campaign and this work, do you have any thoughts on how you would like to see the campaign move forward? How you'd like to see it grow in the next few years? We always say Food4All is a long-term campaign. We're seeing that right now with this delay. We know there's
Proposed delay.
Proposed delay. Thank you. It is proposed only. And so, yeah, I'd love to hear what your thoughts are.
I think you can grow by just getting more participants and more organizations involved. I know we had like the action day and it was really great, and I think more people need to be involved like in the grassroots work and advocating. Even if it's just writing the emails, the coalition has these awesome kits that they'll send you on what to send out, what to post on social media. That's the simplest thing you can do. I send that to my college students, and they send it out to all their friends and all their colleagues and their professors to send it out. That's the simplest thing in my book. And if you are a citizen, I would highly recommend, because our undocumented population, there's a fear to get involved, and rightfully so. So if you have the capacity to join and be a voice and participate without that fear, please do, because that's a right that a lot of them don't have, is to be able to advocate for themselves.
Yeah, so I was kind of thinking also from the guiding questions that you also provided, and really thinking about like how we, like some of the lessons we learned, as Melissa brought out and Jared, advocacy work is really slow and it's really hard, and being part of this coalition has really brought some of those challenges to light. But on the other side, it's also amazing working with coalition and the members within the coalition, because everybody's bringing their different experiences, their different communities, and it's showing us how the immigrant community isn't a monolith. There's such diverse experiences. We have folks like Jared was saying who are within the service and hospitality and industries, and yet they're unable to have food themselves. We have folks who are farm workers who are picking and cultivating the land, and yet they're unable to have food and access and right to food. So really, it's amazing what every organization, what every person can bring to a coalition. I know when we first started doing advocacy work, sometimes we're like, well, where do we fit in? How does this make sense? Or how does this make sense? But really, it's coming at the capacity and at what you can offer. So I think everybody as an individual, everybody as an organization, we have power, and we need to like step into that power to be able to make these systems changes. So really, that's where I would love to continue to see the coalition go and Food4All go, because really systems change. That's what really rallies people. Food rallies people. Like there's no question, like I said, why folks should not have access to food. So that's also another lesson that it has taught us is, having that goal in mind, anything is possible, and we can really continue to just rally around that to make those changes that are needed.
I agree. That was powerful, and thank you so much both of you for sharing that. I also, we're really touching on this idea of stories and centering the experiences of people who are most impacted by being excluded from accessing food benefits. And I know both of you have been involved in storytelling work. Jared, you at the legislative state level have seen the way that we've been able to center stories as one of the most important tools that we use and tactics that we use in Food4All. And I'm just wondering if any of you want to share a little bit more about why and how storytelling is so central to this campaign in your work, how you've seen it being used, and yeah, just anything about storytelling and why we do it.
Yeah. So I use storytelling both for the Food4All and for my CalFresh connection and their enrollment team. And you know, we have data, we have numbers, we know food's important. And like I mentioned earlier, we need to give a voice to those that can't, and that's what stories do. It brings the human component, and it brings the people who don't have a voice because they don't, for fear of sharing. It gives us the opportunity to share their stories without having them step front in the spotlight. So it's really important because I could have a book of stories, right? We could have a book of stories that we're able to share, and it gives that component. It gives people a voice, and you can share it so many ways. You know, we share it on our social media. My college students, they share it amongst each other, and there's multiple ways that a written story can be shared. And I've shared that with my coalition. So my college students will write letters, they'll write poetry, they'll write verses, songs. I've been sent so many songs and poems now, and it's great because it gives people the creative freedom as well to share their voice without having to speak it in a way that they're comfortable with. And it's useful for us as a coalition to be like, look, we have this book and why it's so important. It's a great reference beyond data. That's my thing, it gives the human aspect to what we're doing.
Yeah, completely agree with Melissa, and just echoing off of that. Storytelling is just, it's such an important part of connection and human connection. And it's also really important in challenging those dominant narratives that we live in. Like, yes, California is such a resourceful state. It's one of the richest states, we all know that. But yet, there's still people going hungry in our state. And there's no excuse for that, so that is why, especially in the Food4All Coalition and in advocacy work that CIPC is doing in Nourish, California in general, and all of our organizations, it's important that we bring these stories to light because people are surprised, but sometimes people do not know these things. They don't know the lived experiences of their neighbors, the people that they go, that serve them at a restaurant or that take care of their children. So that's why it's so important that we really highlight these stories, because if these stories are not told, then we're unable to bring them to light and change these systems that we live in, and these systems of oppression, and these systems of exclusion. So that's the only way we can actually bring people together to be able to make these changes.
Do you want to add anything?
Yeah, just from a capital strategy perspective, and a legislative advocacy perspective, storytelling is, you know, what gets you in the door, because members want to hear from constituents. That's who they work for, and that's what they're going to remember, not their lead behind. We do great lead behinds, great one-pagers, but that's not what they're going to remember. The story of their constituent who's saying, "And job."
Be careful of the sound when I'm
Before we move to audience questions, I just want to ask one more question
Right
for
now
all of
I'm
you,
on him, so it's cool.
which is, how do you see success in Food4All? Which can mean a lot of different things, but like, what would success look like for you in Food4All? Besides, of course, Food4All, winning Food4All.
I mean, that's my bottom line. You know, well, I think it's a real success story already in terms of creating this movement. I mean, it should not be understated. 120 organizations is amazing. I mean, and we are contacted by other states and advocates in other states and representatives in other states to learn. And the first thing we tell them is partners, partners, partners. and if they reach out to Nourish, we're like, well, we need to get CIPC on this call. And that's what we tell them, is the coalition work is really the engine that drives the progress.
Can I just add one thing to that? I think I also want to name that Food4All is, this legislative advocacy campaign, but it's part of a greater movement, a social movement in California, in our nation, towards immigrant inclusion. And so I just want to add on to that because I'm like, I think success is like, moving forward in that movement and really building, that view within our work. Okay, please.
Oh yeah, Food4All, that's what we're here for. But I think just in general, the food program, we talk about sunbugs, and that's great. And I want to see market match be used, right? Especially because if Food4All happens, are they going to be able to use programs like that? So I want there to be like a clear, this is what you can have. I want a package to offer people when they're, in their lowest moments. That's what I want. I want to be able to do that. I want to be able to say, yes, you can have that. But as a Food4All coalition, I also want us to be a safe space for those people that we're advocating for. I want them to feel like they can step up and sit here instead of me sitting here and talking about their experience. So that's kind of my goal, is making sure this is like a safe space for them to be able to advocate.
Yeah, same. Same page. But I think Food4All, I just want to, it needs to just have no exceptions, no delays. I think we're a really special place too, in the fact that California is a leader in ensuring that immigrants are part of the story. And immigrants are absolutely essential. And as I'm sure you've already can tell, I am a big systems change person. So really, once again, like ensuring that we are changing these systems within we live, and we are setting an example. Once again, nobody should be going hungry in the richest state in the country. So really, setting an example, ensuring that folks are not let out of these systems in our institutions. And like Melissa said, making sure that we are a place where folks are able to share their story themselves. We're just advocates, but it's so important when folks are actually the ones telling their story, because that is really how we get to that change.
Thank you all so much. I'm moved. I'm honored to be in coalition with you both and with you, Jared, too. We have about 15 minutes left for some questions. I know we also have some virtual folks, so maybe if folks have questions in the room, we can do like a switch off, and virtual folks, I invite you also to ask some questions as well. And Angelus, our wonderful Angelus, is going to walk around with the mic. So does anyone have any questions for our awesome panelists? There's so much to dig into here, floor is yours.
Let's look over their phone number.
I will get to that. We'll save the couple. We have a call to action at the end. I'm with the governor's phone.
Obviously, the first wave, as you mentioned before, is the 55 plus. And once that happens, not if, but once that happens, do you have any plans of what the other waves will be?
Who do you want to take that? You want me to take that? Well, it's no exceptions, no exclusions, no delays. So we haven't, as a coalition, made any strategic decisions about, and we haven't really heard anything from the administration about we'd like 3 phases or 4, right? We don't really know. And honestly, the decision on 55 and up, we were not consulted. We saw, there we go. And so we will continue to push for everybody. I will say we're guided by data, and there is significant data that shows that families with children have particularly alarming rates of food insecurity. That is one factor among many. We have a very diverse and large, even when we have to. Sorry, I know that's not maybe satisfying, but.
Do either of you have something to add? I kind of missed the little part, but I know it's no exceptions, no delays, but the thought of the delay for this population because it was hopefully going to be 2025 and now 2027. It's impacting them mentally, emotionally, and then physically because they're so worried. They were given this hope, like a little sliver of hope, right, for your grandparents, for your parents, and it feels like it was taken away. So we're hoping no exceptions, no delays, but it does cause fear.
Yeah, I'll just really quick share. You know, Kat and her team are disappointed too. I know she's frames it a little differently than I do in terms of, you know, we're gonna fight. But yeah, we need resources. That's all we need. A $200 billion budget. Let's shake the couch cushions.
And do we have anyone virtually who is asking? No questions? Okay.
I can do that. I can ask a question. How often did the coalition meet? How can we get in touch with the coalition and be part of it?
I'm happy to.
No, you can go ahead.
Thank you for that question, Angela. So the coalition convenes virtually once a month currently on the second Tuesday of the month at 10 a.m. from 10 a.m. to 11 a.m. If you are interested in getting involved in the coalition, you want to have your organization involved, you want to attend and learn more, you can just email me. My email I will give to you later. I can also say it right now. It's my name, Jackie, Jackie, at nourishca.org. So just reach out to me. Would love to set up a one-on-one, get to know you. If your organization is interested in getting involved in Food4All. And even if you can't attend the meetings, we have a great email list where we send out all of our calls to action. And once you're plugged in, you know, you're in. Like we will be reaching out for different ways to get involved and to be involved in the work. Thank you.
Thank you, Becky. And who can be part of the coalition? What about if we are monolingual? Do we speak Spanish? Or is there an opportunity for everybody?
Thank you.
Well, they do offer translation on the Zoom call, so that's really great. It's super helpful, especially when bringing in members of the community. You know, that's one of the things that people are always afraid of is the inclusion part. But y'all's translators are really great, and like I said, they're constantly sending out their toolkits and emails, which I know at National Health Foundation we love and we use, and it's on our Instagram.
That's so good to hear. We'll keep doing it.
Yeah.
Shout out to Courtney, real quick in the back.
Yes.
Amazing comms person. Yeah, thank you so much for naming that. We currently at every single coalition call and every coalition convening, we offer Spanish interpretation. But if we, like Kristen was saying earlier, you know, immigrant communities in California are not a monolith. There are so many different ways to be an immigrant in this country, in this state. And so if there is another language that people that you work with or you yourself would like to have available as interpretation at the coalition calls, please let us know. That is information that we need and that we want to know in order to make all of our coalition spaces accessible. And this is another thing that we work with the coalition on as well, is ensuring that our materials are accessible, our spaces are accessible, and that you don't need to be an English speaker to be a part of the work and to share your story and share what brings you to Food4All. Thank you.
Thank you. Luis, have a question.
Hi, thank you so much for sharing. And I'm Luis, by the way. I'm at the San Diego County CalFresh Initiative. And we work really closely with the Food4All Coalition, especially in engaging our COI partners with, especially, unfortunately, the proposed delays. And I wanted to ask a question particularly around, so we have a relatively new community council, and I really want to empower them, particularly around, Food4All and the importance of sharing their story. And so I wanted to, I guess, gain some more clarity on how to really provide a safe space for them, like what are best practices and around storytelling for them to be comfortable to share their story?
Yeah, so as an organization, I think everybody knows their community best. At the Women's Building, I'll use this as an example. We really have like a deep connection with our community members, and we've been able to build that trust. So I think it starts, of course, as an organization, if you're an institution, and then, of course, like developing those relationships personally. It's different for everybody, and this is something that is very, very vulnerable and very personal. So we've done it differently because of how we do capacity building. So sometimes it's like on an individual basis, or sometimes it can be on a group basis. So it's something that, you know, it's organization specific, but it's of course just ensuring, it's really just that part of connection, like ensuring that you have that connection and ensuring that folks do feel comfortable in sharing it. Some people are going to feel more comfortable than others, but creating that safe space for folks to be willing to share, and also connecting it. We have to connect the pieces. Like this is they know, well it's their lived experiences, so they just you know, connecting it to the larger picture of for all why it's important. But they know, and that's where it's like just leaning to that power and have them share their story.
And just give them multiple ways. You said give them multiple ways that they can share their story. Don't limit them, because they'll come up with their own ideas, and it'll be probably far better than anything I could come up with on my own. Just like you said, in different spaces, you're going to use different tools. My college students, I'm not doing the same thing that like my promotoras do with their clients individually. I'm not going to talk to their clients. They have no idea who I am. They don't want to talk to me. But they're going to share with the promotoras because they trust them. They know them. They're from the community. So use those resources. Use those people that are already ingrained in the community, and leverage that in a sense so that they do talk and they feel comfortable to share their story. Because I know they wouldn't share with me. My college students do, but again, different age demographic and different group. So for them, they love to meet virtually, not in person, and that's how we've been able to give them a space where they're comfortable virtually to share, but not have to meet in person. Because COVID made them not like being in person as much. So just listen to them, and yeah.
I also want to uplift something that I know Louis' organization does, and something that we do in Food4All as well, which is we ensure that when individuals are sharing their story, that they are compensated adequately and equitably for their time preparing, so practicing, talking about sharing their story, and then actually sharing their story. So whether that is doing a media interview or attending a press conference and speaking, or writing down their story and sharing it for other purposes, really ensuring a truly equitable and thriving stipend for individuals to it's a piece of the storytelling that we do. Yeah. I think we have time for one more question, if we have any.
Creating here with the Center for Healthy Communities at Chico State. As a person who does outreach in the community and run into a lot of individuals who ask about CalFresh and how they can apply and if they're eligible, but unfortunately because of their citizenship status, they're not. How do you think we can best strategize when we start this outreach work to get those people to apply without the fear of working through the process without, having the fear of something's going to happen to my immigration status or the process that I'm going through currently with my immigration lawyers and all of that stuff, because we run into that a lot. And so I see that as a challenge and a hurdle for all of those outreach individuals who are, wanting to help these individuals, but it's reassuring, building that trust and all that. So.
Yeah, so I think as sharing earlier, it's a lot of relationship building and leaning on the knowledge and the expertise of partners. So it's really important to build those partnerships. If you're part of the Food4All Coalition, we have a vast amount of different partnerships, but if you're like part of a small organization, really reaching out to folks that specialize in those different areas. So for example, in the women's building, we have amazing partnerships with legal institutions, with lawyers, and then with other organizations that have these expertise and are able to help us organize workshops about public charge, about know your rights as an immigrant. And all of these, knowledge is power. So all of these ways of education and outreach enable folks to feel more comfortable getting started in the process and fitting into the process, whether it be for Food4All or for them as an individual, but of course connecting us to the collective.
And I'm hoping maybe we can start like eventually like a whole group like this coalition where we can make insurance rates on how to do that.
Yes, let's talk about that. No, thank you. That was an amazing question, and I think it is like not the end of that. It's only the beginning of that conversation. So I really appreciate you bringing that into this space. And there's a whole other part of this work that we just didn't even really get a chance to touch on, which is the administrative advocacy work, and a lot of that is around that question and around how we can ensure that the actual implementation of these benefits are done in an inclusive and equitable way that actually reaches people. So yeah, let's keep talking about that. And just so everybody knows, Betsy at Nourish, California leads the administrative advocacy work. So if you're interested in getting involved, that is who you might talk to today. So I do want to wrap up. I want to thank everybody so much for your questions and for being here and being a part of this work today and ongoing. I want to thank our amazing panelists for bringing your expertise and sharing your time today. Can we just like give it up for our panelists? And I do have one final call to action. I hope that you're feeling really activated by what you've heard today. I know I feel activated every time I think about Food4All, and so this is like written on a piece of paper, but we do have a really urgent call to action right now. Our legislature is meeting as soon as next week to vote on, or to make some decisions on final budget things, which means the proposed delay of the CPAP expansion. And so what is so important right now is to call our Big Five, email our Big Five, which is what Jared was starting to talk about earlier, that's our legislative leaders and our governor, and to let them know that Californians cannot wait for Food4All and that we need Food4All now. So if you are able to participate in a call to action, it is urgent, but it does not take that long. This is just my handwriting, but if you go to bit.ly/Food4All no delays. I also have a QR code if you want to scan it. It will take you to our website, and there is a blog post that talks about 3 different ways that you can take action right now. Sorry, I'm gonna hold that up. And hopefully, I think Courtney maybe put a link in the chat too. So if you're virtual, click that link. Much better than looking at my handwriting, but it has a form that you can use to send emails right now to the Big Five. Please personalize it. Use what we wrote and then add your story, add why your organization or why you as an individual really want to call for Food4All. You can call all of the offices. We really recommend that as well. And then you can post on social media. There's a little social media toolkit involved there as well. So thank you all so much again. So good to be here.